India is on its way to becoming the world's largest COVID-19 hotspot. With 4.3 million cases, India has surpassed Brazil as the country with the second highest number of infections. Public health experts warn it's inevitable India will soon claim the record.
It's not surprising that the numbers that are coming and by these, the way it's spreading and by the way testing is improving, India would be at the top level for this by end of September.
India has ramped up coronavirus testing and is now conducting more than 1 million a day. But the virus shows no sign of slowing. That hasn't stopped the gradual reopening of the economy and schools, though.
We have to open up the economy. We have to lift restrictions, otherwise work isn't possible.
How to protect people's livelihoods while also protecting their lives. It's the high-stakes decision being faced around the world. India's battle with coronavirus is unparalleled around the world. It's subject to one of the world's strictest lockdowns, introducing tough measures back in March when there were just 500 cases in the country. But that didn't stop the spread. India is posting record numbers of new cases on an almost daily basis, with nothing to suggest the curve is nearing its peak. Over the past couple of months, India's average number of cases per day has risen from below 30,000 to over 80,000. Even the US, at its worst, wasn't posting figures that high. Meanwhile, hundreds of thousands of young Indians, desperate to get into top-level universities, have been taking part in highly competitive exams. Safety measures are in place, but many students are worried that a few days after the college tests, they'll need COVID-19 tests too.
Examinations during a pandemic. While schools and colleges remain closed as India records the highest daily rise in cases in the world, these students are appearing for a crucial test. And it's testing like never before. Masks assigned at the exam center, constant sanitization, and repeated calls for social distancing. Parents and students here are reassured by these measures. They say they cannot afford to lose any more time to the pandemic.
All the candidates were trying hard to give this exam, but yeah, it was okay because as all the safety measures were taken, so that it was okay to give the exam during the pandemic.
They could have conducted this exam in April. The caseload was low then, but they pushed it to July and now this. They can't afford any more delays.
Yet, not everyone has been this enthusiastic about the tests. Many of the competitive exams held every year in India have faced stiff opposition this time. Students have protested online against the risks they say they are being forced to take and have even approached the Supreme Court. Students took to social media to trend the hashtag Rise Against Exams in COVID. While the Supreme Court has rejected their demands, students say forcing them to appear for the exams is cruel. Pavni Agarwal, an aspiring doctor, is expected to travel 150 kilometers next week to her test center. She hasn't stepped out in 5 months and is terrified to do so. She heard rumors over social media that another exam led to dozens of COVID-19 deaths.
I know many students whose parents are asking them to skip exams this year. It is far too risky to go for them. Nothing is decided for me either. My family is scared. They don't know whether I should go for this exam or not.
Opposition parties have taken up the cause as well. They accuse the Modi government of being anti-student. Protesters insist they don't want the exams cancelled, but simply postponed until it is safer.
We are sharing the concern of the students of the entire country and their parents. Because opposition said government already given a request to the Prime Minister of India to postpone this examination for time being.
These students, however, intend to get on with their plans. They say their careers will have to be formed within this new normal.
Well, we can now speak to DW's Delhi Bureau Chief, Amrita Cheema. Thanks for joining us. So India's seeing this seemingly constant and very steep rise in cases. What's behind it?
You know, Rob, people are describing India as a new epicenter of this coronavirus. In the past 24 hours, almost 90,000 new infections were reported. Now, As for reasons, there are several. If you ask the government, they'll say, we are testing more. They're carrying out kind of 1 million tests a day, and that's set to increase. So they say the more we test, the more cases we're likely to find. But of course, we also have to keep in mind that India is easing restrictions throughout the country. They just announced this week the unlock phase number 4. Life is coming close to normal. They've also allowed metro rail stations to operate with some restrictions. And then one must also admit that people are becoming a bit casual about these restrictions and about their lifestyle. They're not taking the kind of precautions that they've been advised to take, but simply they are fed up.
You mentioned about the large number of tests that are being done, and the death rate would seem to bear that out. India does have quite a low death rate, about 1.7%. You compare that with 3% in the US. Is that a fair defence, therefore?
Well, the government is taking consolation from these figures. They say our fatality rate is low in India, and they also say our recovery rate is very high. But when you talk to some of the economists, they say these numbers are misleading. It is true that India's fatality rates are much lower than in Europe and in North America, but they're not that low compared to other Asian countries, especially in South Asia.
That's the government and the experts. But how are regular Indians feeling? Do they feel it's out of control?
I think there was a sense of panic when this pandemic first started in March, April. People were extremely worried. But I do think that people are also feeling less panic-stricken simply because they believe that these numbers do reflect to some extent that India is doing quite well. And it's all anecdotal evidence. There's no science to prove that is the death rate low. But people also then, again, anecdotally, talk about a lot of missing death cases, that these numbers are not as reliable as the government would have us believe. People are always talking about, I know so-and-so died, I know so-and-so who died, and they feel maybe these numbers are not quite so reliable as the government would have them believe.
India brought in a strict lockdown pretty early on. What's being done to try and get on top of this rising number of cases?
They have implemented a lot of measures, but it must be said, as the lockdown, when it was first implemented on the 25th of March, was one of the strictest in the world. And India came up with this lockdown fairly in the early stages of the pandemic. But what critics are saying, they didn't make the most of the time. It was not managed very well. It was ineffective. They implemented the lockdown with 4 hours notice. There was panic among people. And they did not use this time to build resilience within the health system. So they lost crucial time there. And now they've implemented several measures, of course, which are testing camps. They have a COVID app that they've asked everybody to download. And they've strengthened kind of capacity in hospitals and things. So they are taking measures now, but a bit late, many people feel.
You mentioned the healthcare system and the hospitals. I mean, how is the healthcare system coping?
The healthcare system in big cities was under great strain in the initial stages, and you heard really kind of dire stories about people dying in cars, waiting to get into hospitals. But now they have improved the situation in hospitals a lot, but there's a big difference between who can afford healthcare and who can't. The private healthcare system in India is very good, but it's expensive, so not everyone has access to that. And now the big worry, Rob, is that this virus is spreading into rural areas, and there the health system is very weak.
To some extent, India's pinning its hopes on a vaccine that is trying to develop itself.
It is, and India is one of the leading countries working on a vaccine. There's some very promising trials going on, clinical trials, but there's no sign of a breakthrough at the moment. And even if there were to be a breakthrough, Rob, then the distribution, how do you distribute a vaccine to 1.3 billion people?
The vast numbers is, as always with India, the issue. Thank you so much for keeping us up to date. Delhi Bureau Chief Amrita Chima. Now it's time for one of your questions to our science correspondent, Derek Williams.
What are your thoughts on rapid COVID-19 tests for daily use in the population?
For this answer, you need some quick background. Right now, the gold standard in testing for COVID-19 is a method called PCR, or the polymerase chain reaction method. Now it's very accurate, but it's also kind of slow, and it has to be carried out in a lab by professionals, which is why in some countries, like India, they've turned to what are called rapid antigen tests, which don't test for the viral genetic code, but just for one of the proteins that it expresses. They're a lot cheaper and they're faster, and they could be potentially self-administered, but then they're also a lot less accurate. Still, proponents of widespread testing with them say the upsides of the technology outweigh the accuracy issues because they could play a key role as a frontline surveillance tool, which PCR at the moment can't really do because of its complexity. Now, on the surface, everyone testing themselves all the time sounds like a good idea, but a lot of researchers remain pretty skeptical that it'll actually work out. I mean, you'd have to produce a huge number of tests. For Europe alone, we're talking about billions of them every week. So a major production challenge when facilities are already stretched. And with most commercial antigen tests, significant accuracy problems could really erode how much trust people eventually place in the results that they give, discouraging their uptake. So I'd say that, yeah, the idea of more testing through rapid antigen tests is a great one in principle, but most of the experts I read say we shouldn't expect them to turn the tide on COVID-19.